All right. Hi, guys. I'm Victoria, one of the chief residents at Loma Linda, and with me I have Zach, one of my co-chief, as well as our program director, Dr. Lee, who is joining us here. So we'll give you kind of a brief overview of Loma Linda, our program, and then we'll open it up to questions. So we are the Loma Linda University PM&R program. So where is Loma Linda? It's, for those of you who don't know, it's also located in the Inland Empire. This is us for this red dot. So we're about maybe like an hour and a half, an hour away from LA, depending on how fast you drive in traffic, and then about an hour and a half from San Diego. So an interesting thing about, Loma Linda is so if you guys haven't heard of it, we're one of the 5 blue zones in the country, or nation. 5 blue zones in the entire world, actually, where it was published in National Geographic, but they did a study and it determined that people in these areas lived longer than any other area in the world. So of the 5, Okinawa, Sardinia, Loma Linda was one of them, as well as Icaria, Greece, and then Nicoya Peninsula in Costa Rica. A lot of that they deemed was due to diet, which takes us kind of into our next part. Here we go. So Loma Linda University Health is actually affiliated with the Seventh-day Adventist Church. And one of the goals of the Seventh-day Adventist Church and Loma Linda University is to further the teaching and healing of Jesus Christ and to make man whole. And we are a vegetarian hospital at this area, more plant-based, and that's kind of what they think is why we are, that people in Loma Linda have a longer life expectancy. So a little bit about the PM&R residency program in general. So this is just some pictures of our outpatient and inpatient rehabilitation building. So it's the outside and inside. We aim to educate and equip physicians in PM&R to foster compassionate and growth-minded physicians and long-term, lifelong learners and promote excellent whole person care. So positions, we are a both a categorical and an advanced program. So we actually have 4 categorical residents per year that start as a PGY1, and then 1 advanced resident per year that starts as a PGY2. So this is just some pictures of our residents. We were making a thank you card for one of our attendings who was leaving. So training sites, we rotate through 3 main training sites during our PM&R years. Our main Loma Linda University hospitals, and then our VA system, as well as the Kaiser system. If you do join us as a first year, we also rotate through Riverside University Health. So just overview of some of our rotations. For PGY1, during their intern year, they actually do a lot of their rotations with the internal medicine program. And so they do internal medicine wards for 4 months, ICU, and then some subspecialties, usually ID and nephrology, as well as rheumatology, neurology, about half a month of night float, and then you rejoin us for PM&R, and then you have 1 elective. For PGY2, we, a large portion of our inpatient rehab is in our PGY2 years, so we do stroke and brain injury, as well as at Loma Linda, and then we do some general orthopedic inpatient at the VA as a junior. And then for our outpatient rotations, we just do musculoskeletal outpatient at the VA, and then for Loma Linda, we do kind of a whole hodgepodge of outpatient, so SEI, stroke, TBI, etc., as well as pediatrics. And then PGY3, most of us do SEI, and then a couple of us do an additional month or 2 of TBI as well, and then we still continue the same outpatient rehabilitation rotations at the VA with MSK, ultrasound, etc. And then we also do an additional 5 months of EMG and some elective time. And then finally in PGY4, we have about 2-3 months of inpatient again, where you're acting as a junior attending and supervising a junior resident. And then we also have the same VA outpatient that we had, our Kaiser rotations, and then the Loma Linda outpatient rotations where we would do SEI, stroke, TBI. And then we also have pain and pediatrics during our 4th year. So a little bit about the didactics for the program. We have 2 major series. First, we have our rehabilitation series, which encompasses some of the core topics of PM&R, so stroke, TBI, neuromuscular, O&P, SEI, PEDS, pain, etc., as well as grand rounds, EBM, journal club, M&Ms, quality improvement, and whole person care. These take place on Wednesdays, and we currently do them in 2-hour time blocks from noon to 2 p.m. And then we have our musculoskeletal series on Fridays from noon to 1, and that we focus on different body parts at a time, and then we go over the anatomy, kinesiology, physical exam, radiology. We do some practice oral board cases, and then we run through therapeutics, PT, OT, different modalities, and then we practice ultrasounding. In addition to these main ones, we also have a built-in resident wellness series, a neuromuscular disease and EMG seminar, and some time in the anatomy lab. Currently semi on hold due to COVID, but previously we would actually assist with medical students as they're going through their anatomy rotation. And then this year we're actually adding in formalized kind of how to conduct research curriculum. So research and moving on to research and scholarly activity, all residents are expected to participate in research and scholarly activity. We have a lot of support and guidance from our research advisor, Dr. Tran, and then we meet quarterly in research labs with your co-residents to kind of brainstorm your topic and see what other ideas people can help you with. And then during your 4th year, we have an annual research day. Well, every year there's an annual research day, but 4th years are presenting their cumulative research project for the entirety of the residency. So a lot of you guys want to know about the call schedule. So intern year, it kind of varies based on the program if you do it outside, and then if you are a categorical resident with us, that also kind of varies depending on what rotation you're on. But PGY2 through PGY4, we have 4 weekend calls per year where we would cover the Loma Linda East Campus patients, which is our inpatient rehab teams, as well as our VA inpatient and whatever consults between the 2 facilities. And then you have up to 20 days a weekday night home call per year spread out in 2 night blocks. And so you would cover Monday, Tuesday, or Wednesday, Thursday, and you would be covering the same 2 locations. So what makes us kind of unique from other programs? I think a large thing that sets Loma Linda apart is the whole person care curriculum. We really focus on looking at a patient as a whole and addressing their emotional, physical, social, spiritual needs instead of just kind of addressing a single problem, which is something that I think a lot of people who go into PM&R are really interested in, just kind of looking at the whole patient and the holistic approach to patient care. So that's something that's really interesting. We're formalizing a whole person care curriculum that we're rolling out this year as well. And then we also have very supportive faculty, mentors, staff, co-residents. Like other programs we're saying, all of our attendings are super approachable and very easy to talk to. I have a lot of their cell phone numbers. If I have questions, I don't hesitate to ask them because I know nobody's gonna get mad at me for asking a question. And then all of my co-residents are super supportive, and we do a lot of team bonding activities when it's not COVID. And we actually have a wellness committee specifically focused on resident well-being, who kind of also functions as our kind of social chair. So we've done a lot of, we have 2 annual retreats every year, where we've gone to LA, San Diego, we've done karaoke, all sorts of things. Sorry. We also have an in-house pain fellowship program that's run through the PM&R department. And then our MSK and Core Physiatry Didactic series is very strong. And then Can't Beat location, Southern California is awesome. We kind of get the best of both worlds. We're pretty much an hour away from anything you want to see, mountains, beach, desert, and then 3 hours away from Vegas, if that's what interests you. And then I know some of you guys were asking about volunteer opportunities and kind of sports, adaptive sports. We do have a possibilities program where we have a lot of opportunities for patients with different conditions, amputations, etc. And a lot of our patients actually come back and volunteer through possibilities to kind of talk to other people. And then there's adaptive sports programs. One of our current patients is actually a world famous Paralympic athlete. And we have the opportunity to volunteer with possibilities. So if you guys are interested in our program, here's the email address for our program coordinator. You can go ahead and reach out to her if there's anything that, any questions you have that we don't address from here.
So we are here to answer any further questions you have. I see one question here. How would an atheist fit into your program? Very well. There are people from all different religious backgrounds within our program: atheist, agnostic, Christian. Throughout the gamut. In fact, there are, we've got a medicine residency, surgery residencies, probably any residency that you could ever consider here in Loma Linda, and there are people from all walks of life and all backgrounds, and so everyone is more than welcome to come and enjoy learning more about kind of the whole person care and how to take care of your patients kind of from that standpoint. So great question.
Yes, thank you for joining us. So what made me choose Loma Linda? Mostly, I did like the whole person care focus. I went into PM&R wanting to kind of look at a patient as a whole, and I felt like that was demonstrated throughout the rest of not just the PM&R program here, but throughout the rest of the facility. And like Zach had mentioned, there's a bunch of different residency programs, and I feel like they also focus on that as well. And so that was nice. And then I had done an away rotation here and enjoyed working with all of the attendings. Everybody was very supportive, and that was just kind of the environment that I wanted to be in.
So I'll answer that question as well, and then we can keep going. But the reason that I chose Loma Linda is just kind of the culture that's here. It's very much familial oriented, and the space that I was in when I was in your guys' shoes, at least for the MS4s, I was just about to have my first child. And I wanted someone who was going to support me both professionally and personally. And so as a PGY4 and kind of a chief resident here, I do feel like I've been supported both professionally and personally. I now have 2 children, 2 boys actually, and it's a very supportive environment. It's a very familial oriented environment. A significant amount of our residents are either married or have kids. Victoria is not one of those, so being single won't preclude you from coming or finding happiness here, those kinds of things. But that's why I specifically chose to come here. Let's see. Are there any practices or procedures, have any that you are prohibited from performing? No, there are none. And again, a great question.
follow up. Is there a way to join in on Didactic or virtual opportunities available? So right now we're not doing any virtual rotations or anything like that. We are planning a virtual meet and greet with some of our residents at a later date in September that will that we have to determine. But if you're interested in reaching out to the program, go ahead and email Liz Tapia, our program director. We're about to post her email in the chat. That's probably the best way to get more information about us and to kind of just reach out to the other residents.
Got about 4.5 minutes left.
Okay.
Okay, so I didn't put it in the PowerPoint, but if you do go on the PM&R Scholars Google Doc in the Loma Linda folder, we do actually have a list of where our residents go on, where our residents from previous years have gone on to do, but typically about half of them go on to general PM&R practice, and then about half of them go on to do fellowship. So me personally, I'm planning on going into general practice, and Zach is applying for pain fellowship. So it's pretty much like a 50-50 split between most of our residents. But we've had residents do pain fellowship, sports and spine. Those are our two major ones. And then one of our residents this year is interested in cancer rehab, so she's applying to that.
I think that's probably the major ones. I mean, Victoria actually looked into an SCI fellowship this year, decided it wasn't, what she wanted to do ultimately, but there are people who are also, I know that one of our PGY3s is interested in pursuing TBI, and I think one of our 2s actually is interested in pursuing SCI. And so we have people who go into all different kind of specialties and subspecialties within the world of PM&R, both in private and academic worlds. Not that I know of. I don't think that there are any opportunities to work with any local professional or amateur sports teams. I mean, I guess we do have, I guess this would fit under the amateur side of things, from a sense that residents can go and actually work with high school teams in the area. And so I think that would be kind of our avenue to sports. I will say that over the 2 prior years, we had 2 people actually both match in sports and spine fellowships that are pretty well renowned across the country, who had the same opportunity to work with those high school sports teams and work with sorry guys, we just had a notification pop up. Work with the athletic trainers and the sports physicians that are there. And so that exposure absolutely is here. And if that's something you're interested in, you can be exposed to that. No professional teams, but we do have the high school sports teams here in the local area. I have no idea. Any other questions, guys?
All right, well, if not, thank you so much for joining us. And you do have Liz's email. If you're interested in our program, go ahead and shoot her an email, and we can keep you updated about when we have our follow-up kind of resident meet and greet.
One thing I will say for those of you guys who are on the East Coast, there's no like coastal bias here at Loma Linda. We have residents from all over the country who are here. I mean, Victoria actually trained in Philadelphia for med school. I trained in Washington, D.C. And so don't let if you guys are out there on the East Coast, don't let that kind of be of concern to you. Know that you can match and those kinds of things. Possibilities program is an adaptive sports program, yes. And so it's actually, they actually do a triathlon every year, but they also do mentorship. So they actually have spinal cord injury patients or traumatic brain injury patients or cerebral palsy kids who actually can then mentor other spinal cord injury or traumatic brain injury or CP patients. And so that's something else that you can get involved in from the sports world as well. So.
Yeah, a group of us were planning on doing the mini triathlon with them, but then COVID happened, so it was canceled this year.
Awesome. Well, thank you guys so much for joining us.